Hi, Dr. Dave Webster. Welcome to my website. This is just a brief section on the provincial federal issues. The provincial issues are quite straightforward. The provinces decide what they're willing to pay for or not, and as you know, the government does not want to pay for pets, so they've taken us to last place in the world because they don't want to pay for it. But at the federal issue, the most important part is the Health Canada. Health Canada is charged with looking into whether or not it's safe, for example, for patients to have certain drugs, and also assess the kinds of radioactive tracer substances that I, as a nuclear medicine physician, am involved with injecting into patients and studying patients with imaging through nuclear medicine, and PET scanning is simply part of that. But however, there's a major difference between what we use in nuclear medicine, which are called radiopharmaceutical tracers, versus substances which are intended to have a true pharmacological effect. When you take a drug to treat your blood pressure or whatever, that it's taken with the intention of having some effect in the body. The point about us being able to use radiopharmaceuticals very safely is because they specifically do not have any pharmacological effect, because they are in such trace quantities that the body virtually doesn't know that they are there. We're using less than a billionth of a gram of these tracer substances. It would be the equivalent of, for example, patients can be deathly allergic to iodine, and so if they're having a CT scan, they really don't want to have a contrast reaction. They don't want to have the contrast with the iodine in it, because there's a chance that they might die from that. But you must remember that these patients also eat salt with iodine in it, and they don't have any problem. That's the kind of level I'm talking about that we routinely inject into patients in nuclear medicine, something called radioactive or radio tracers. And so when we talk now specifically about the PET agents, the government has been evaluating those, and what they've been using is a piece of antiquated legislation written at the time of the Irish potato famine, if you can imagine. That's the mid-1840s, and guess what? There was no they didn't simply know about the existence of radio tracers at that point, but what's a poor civil servant to do in the bureaucracies at the federal Health Canada level? So they're using legislation which was not remotely intended to evaluate something which was specifically not supposed to have any pharmacological effect, but they're using a piece of legislation that is looking at things that actually are supposed to. And so the situation was this. I finally got to the point where I was so frustrated with the embarrassment of Health Canada on this issue that I wrote them. I wrote two federal ministers of health, and I eventually wrote Mr. Tony Clement. And the point I was making was this, was that I documented that several $100,000 of not taxpayers' money, but money that was actually supposed to be used for cancer research had been basically shunted through Health Canada into the Ottawa economy to have civil servants fill out paper forms as to whether or not we could inject less than a billionth of a gram of radioactive glucose into a cancer patient. And this is at a time when at the world level, over a period of about 20 or 25 years, there had probably been about 12 million doses of this radioactive glucose injected into cancer patients without a single reaction in a human. And yet Health Canada was not quite sure it was safe for humans. So you have this extraordinary situation of Health Canada using this antiquated legislation to regulate all the stuff that we do in nuclear medicine, and I assure you there's absolutely no political will to change this. This is what keeps these Health Canada and the various other bureaucracies that handle these kind of things vibrant and healthy. To give you another example that's relevant is during the Chalk River crisis, you'll recall that we had a shortage of something called technetium-99m. It's certainly the commonest radioactive substance that is used in the world, and as a nuclear medicine specialist, this is the commonest radioactive tracer that we use to scan patients. But it was a very critical shortage in the world. I mean, it was it was a terrible situation for my patients. I mean, there were times and weeks where we were down to 20% of our usual supply, and we were simply unable to do critical tests on cancer, on patients and cancer patients. Surgeries on breast cancer patients were canceled, and so on. That situation actually could have been looked after much differently in Ontario. It did not have to be as severe. It wasn't in Quebec because they have access to PET scanning. That's a topic of another video on my website. But anyways, the bottom line is what we thought was, okay, well, why don't we now start, because we don't have a technician to do bone scanning, let's now just do what the world now understands is certainly a far better bone scanning agent than the technetium agent that we're using, and that is let's just inject the radioactive fluorine 18 into the patients themselves. What we're using in PET scanning mostly is radioactive fluorine F18 attached to a glucose molecule, and again in quantities that are less than a billionth of a gram, into patients, and that we image the radioactive fluorine. Now, so we thought, well, why don't we just inject the F18? My God, you would have thought, that we'd ask for the world. Even though at that point Health Canada had, in their wisdom, finally decided that it was okay maybe to inject radioactive, fluorinated glucose into cancer patients from a few suppliers in Canada, that was safe to do that. But oh my God, what about just injecting the F18 without attaching it to the glucose? Not sure if that's going to be safe for people at all. So it took an extraordinarily long length of time for us to actually get clearance to do such, something that is routine around the world, but hey, this is Canada. We're an embarrassment, quite frankly, at the international meetings when I go there. It's just extraordinary what happens in this country. Anyway, we eventually were able to do that, but now that, and we did a few patients with fluorine 18, but now that the chalk river is back up again, guess what? We can't do F18 or radioactive fluorine bone scans. So far better tests for our patients, but we're not actually allowed to do it because, you know what, Health Canada is not quite sure this is safe for patients. So guess what? A lot more money that you thought was going to be dedicated for cancer research and so on will now be spent paying federal civil servants to fill out forms so that, guess what, we can inject less than a billionth of a gram of radioactive fluorine into patients to do a bone scan. It is, as well, Dr. Dreger said, the blocking process of PET, in Ontario is immoral. The fact that that there's simply no political will, and that this Health Canada has the gall to stand up and tell us that they're not sure that after now 20 million doses of radioactive fluorine compounds being injected into cancer patients over the past 25 years, and not a single reaction, for them not to be sure this is safe for patients is, what can you say? It's disgusting. It is immoral. So for those of you watching the video, I will have the contact information for the federal people, the Health Canada people that are involved with this. I would encourage you to finally demand that these people stand up and explain to us why they are using completely antiquated and legislation would have absolutely no intention of dealing with radioactive tracers, why they're using this and absorbing massive amounts of money which could have been dedicated to cancer research to try and decide whether this stuff is safe to inject in humans or not. It's pathetic. Anyways, look on the website, get mad, send us out to everybody. En masse, we need to use social networking to finally demand openness, transparency and accountability from politicians and their various bureaucracies. Thanks.